So Arja Rautio is a professor at the University of Oulu. She has a medical degree and has been working in the topic of Arctic health and well-being since 2006. And she is a member of a Sustainable Development Working Group of Arctic Council. And now, Arja, please, you have the floor.
So thank you very much, Madam Chair, and very much thanks for inviting me to give these comments from Arctic Council. So I have been now working around 10 years as a Finnish representative in health groups of the Arctic Council. And Arctic Council, it consists of 8 Arctic countries, Nordic countries, Russia, Federation, US and Canada. And there are also 6 indigenous organizations around the whole circumpolar north. And Sami Council is one of those 6 organizations. In the meetings of the Arctic Council and also in the Human Health Expert Group, there might be also representatives from the observers of different countries and scientific organizations. For example, EU is one of the observers who can be participating in our health meetings. Sustainable Development Working Group was the last established group in the Arctic Council 1998. And there are altogether 6 working groups and mostly focusing on the environmental issues. And this Sustainable Development Working Group is focusing on the Arctic population, which is now around 7 million inhabitants, and indigenous peoples are covering around 10 to 12% of the whole population. And it is like a human dimension of the Arctic Council. In the strategy of the Sustainable Development Working Group, it has been saying about the human health. It is exchange information, assessments and innovations that can support public health systems and health service deliver, with emphasis on the project that reduce death and disability from environmental risk factors, suicide and high burden infections and chronic diseases. Very early in the mental health, and especially suicide prevention, has been one of the key elements of the health projects, since suicide among indigenous youth has emerged serious public health challenge in the circumpolar north over the past several decades. The wave of the suicide has been like an epidemic covering all other countries and regions. The problem is still existing, although much research has been done to understand its causes and various interventions has been also done. A big step and start was the Hope and Resilience Suicide Prevention in the Arctic Conference, which was held in Nuuk, November 2009. The unique part of the conference was an important focus on the youth representatives and their message, and the joint discussion with the governmental ministers and other policymakers. And 2 years later, there was the Arctic Health Declaration was signed, and especially to focus to enhance mental health and prevention of substance abuse and suicide through exchange experiences and good practices. And 2013, Canadian Institute of Health and Research launched a funding program to support the creation of international teams to synthesize current knowledge, develop evidence-based and identify promising practices for scaling up by Arctic regional governments and indigenous organizations. Under the Sustainable Development Working Group, there have been important projects. Mainly they have been only 2 years, which has been focusing on the suicide prevention, starting from the Sharing Hope. It was 2013, 2015. It was during the chairmanship of Canada, and Rising Sun It was during the chairmanship of US, and it was followed by the Circumpolar Resilience Engagement and Action Through Story, CREATES, which was coordinated by Canada, and it was co-led by Inuit Circumpolar Council, together with Finland, the Kingdom of Denmark, and Sweden. This project was a very nice initiative of Sustainable Development Working Group during the Finnish chairmanship of the Arctic Council 2017 and 19. And this CREATES project invited youth to engage in a dialogue about suicide prevention by telling their own stories, supporting them to make their stories into digital storytelling way, and also short films. And you can see the results of this project. There is a collection of altogether 30 digital stories where Circumpolar youth have experience related to the issue of the suicide. And it's available in the project website. This work with the suicide prevention, it is continuing. Now we have the project Local to Global, and it's lasts until 2023. And it has 3 pillars. One is to continue the digital storytelling workshops. Second one is to promote suicide prevention strategy and policies. And third one is to focus on advanced experiences and the links between those and suicide prevention. During the corona pandemic, the personal meetings and studies tours have been moved to the virtual knowledge exchanges. For example, between Inuit Circumpolar Council and Sami Council. Indigenous peoples, they bring their holistic nature of the solution, so that when we are talking about the solution and better housing, it is suicide prevention. And also if we ensure food security issue, it is also connected to the suicide prevention. There are also many other success stories in the suicide prevention and improving mental health. For example, combining the cultural aspects where the elders and youth can together with the traditional music or taking care of the sled dogs together. And all these activities, they have decreased the numbers of suicide in the many communities across the Arctic. And for conclusion, I think that I'm really sure that the work of the suicide prevention and generally mental health will be in great importance in the future work of the Arctic Council. And when the suicide is just the top of the iceberg, there is a lot of work to do with the mental health and well-being. And at the moment, of course, the effect of COVID pandemic is one of those which also includes the mental health aspects, and some of those projects they are going on under the Sustainable Development Working Group in the Arctic Council. So thank you very much.
Thank you, Professor Rautio, for these comments, and it gave us a clear picture that there's a lot in common with Nordic countries and broadly as well in the Arctic cooperation. So now I think there's a lot of questions and comments already waiting for having the floor. So who would like to start? Yes, please. Now you have floor in the middle. Yeah. And while you are getting the microphone there, once again, thanks for Nicolin Damsma also for sharing the activities of the EU. So I think that's also very important for all of us, and looking forward also there to have mental health in the future as well as one of the priorities supporting our activities, and we are looking forward especially for the mental health strategy for EU in Finland. As was said already in '99, we took that as a priority, and so perhaps in the future. So, but first, one question there in the middle, please.
Yeah, thanks Lydia, and thanks Nicolina, and thanks Arya. I think it's a wonderful power trio of women that will lead us very well here. And I think what connects me is the discussion around, if we want to grow our ways of working with this, what comes back to me is, how do we build organizations that are able to learn? And that is probably really important for the health of the workforce as well. And leadership, of course, is crucial to make that happen. So how do we get to start training how to work together to make organizations able to do innovation internally and not just externally? And also then coming back to the best practices, the implementation of those, but that whole architecture of working together between professions and leadership and policy, how can we address that jointly to make the capabilities strengthened even more?
So, who would like to start? Is it first Nicolin or Lydia? Nicolin, please. I noticed that you are ready there already. So please.
Yes, I'm trying to juggle. I'm happy and ready to answer whatever questions. Well, thank you for that question. I think what is at the center of what the Commission is trying to do is to encourage cross-national learning and the implementation of best practices. So in that sense, there's a lot of learning happening there already. And it's exactly meant to do that. Now, in terms of strengthening organizations per se, some of that will have to be done at national or regional level. But don't forget that the EU also has all kind of other funds that can support capacity building. Actually, capacity building is part of, and strengthening health systems is also part of the EU for Health program as such. But there is DG Reform supports national efforts, and that can also be in health. It can also be to strengthen mental health. And so there is quite a lot of different opportunities where the EU can support capacity building and cross-national learning, but ultimately, it also has to happen locally and at a national level and with support from there. So I hope I helped answer that question.
Yes. And Lydia, would you like to continue?
Yes. No, it's yeah. Yes, thank you. I'll approach also from the perspective of how we in WHO are looking at it. I mentioned in my presentation that we are going to develop 7 working packages. So there are 7 themes, and 7 working packages are to be developed collectively within the realms of the Mental Health Coalition. One of those is about leadership, mental health leadership, and I have encountered a bit of a misunderstanding among some partners from some parts of the region who tend to think that, okay, this is about the decision maker at the ministry and a minister or a deputy minister or someone, a leader of a mental health unit in a Ministry of Health. But it's actually more than that, and it's, as many of you know, this will be our approach to change the service culture and to empower all the service providers in parallel to the service beneficiaries, of course. So, and I mentioned that very soon next year we are going to convene, and this will be one of the packages that will be discussed. So probably we meet again in that environment.
Yes, thank you. Other questions or comments from the floor? Or do we have any there in remote? Oh, yes, we're in the middle, please, yes.
Yeah, David McDade here from the London School of Economics. It's a comment to all speakers, actually, and it kind of is a little bit similar to Frederick's. But is there more that you can do, particularly, well, in WHO and EU perspective, in terms of trying to work with your colleagues, for instance, in WHO in the other UN agencies to think about this at a whole UN perspective, because some of these things are UNESCO or UNICEF or whatever. So is there more that can be done there, and also within the European region in that sense? And again, I know, Nicoline, you mentioned, for instance, DG reform, I think it was, and there's been work done across DGs in the past, but is there more that could be done to really try and have this kind of cross-sectoral approach? And I guess for Arja, I don't know enough about the Arctic Council, but do you already work cross-sectorally in the Arctic Council and not have these barriers? But I just wondered, what more can you do to strengthen that cross-sectoral approach to working at these intergovernmental agency levels?
Really essential question. Is it so that Lydia would like to start and then Nicoline and Arja? Yeah.
Yes, indeed. It's a very, very important question. One concrete example is, for instance, in the area of a child, adolescent and youth health. We are already in partnership with UNICEF, and there is a memorandum of understanding between WHO and UNICEF, and we are trying now, as we speak, to liaise with UNICEF about looking into how to approach it together. Also because UNICEF, by default, is more operational than WHO. So if WHO is more norm-setting, policy environment, but with UNICEF together we can build synergies. But also within our own WHO, like we preach the cross-sectoral work, but we are also trying within mental health now to see how we can cross-sectorally work. And for instance, for some of those who are informed about WHO work, we have an office, for instance, dedicated to social determinants of health, or officially it's called the Office for Health Investment in Venice, in Italy. And also Finland is working with that. So we are trying to work with them to see how to promote economy of well-being for youth, for adolescents and youth. So you see, we are also trying to ourselves within WHO to reflect upon to walk the talk of what we say. Thank you.
Yes, thank you. And then Nicoline, please. Yes, Nicoline, please.
Thank you. Hello, David. Lovely to be connected with you. Yes, to answer your question, there is an awful lot of cross-policy work happening at the moment at the Commission level. There is a lot of awareness with colleagues, for instance, in DG EAC, which are the education people, and also working on youth. We're working together with colleagues in DG Justice that work on the right of the child, which actually has embraced health and also mental health as one of 6 priorities. The Commissioner actually was with UNICEF at the launch of their report on mental health of children. I myself, as just a simple example, these past 2 weeks I attended 2 different meetings, one from DG Home that is doing some work on mental health of migrant communities to see how that can be supported at local level, and DG Employment that's working on thinking about changing or revising the digital screen equipment directive, which is a very technical thing, but they are aware that this also, screen time is important for mental health. These are just examples, and this may not be so visible, but you will find that there's a lot of policy documents and initiatives coming out from other DGs that actually include elements of mental health, and this is exactly, of course, the mental health in all policies that I think we all want other people to embrace the issue and take it forward through their policies. So thank you for the question.
Yes, thank you. And is Arja still there online? Would you like to take the floor?
Yeah, so that I just move another place. I'm in Berlin in a EU project General Assembly meeting, and that's why I couldn't stay in the earlier place. So that thank you for that question, and so that thinking that the Arctic Council is now 25 years old, and it has been focusing very much about the environmental issues first, and then it came this Sustainable Development Working Group. And I think that also inside that it has been the silos a little bit more, but now I think that more and more people are thinking thinking that having the approach like One Health, so that it's a health of environment, wildlife and humans, that it's joined, so that it's also covering the mental health and that aspect. So it gives also possibility to go closer with all those changes which is happening during the big changes of the climate change and global change. And I think that that's also helping. And when I also told that there are every 2 years period when there is a different suicide prevention or mental health project, and it's led by somehow impacted by the country who is leading the chairmanship of the Arctic Council. It also gives the possibility to have a little bit different types of some countries are focused more on youth themselves and their voices, and some of those structures of the mental health issues in whole circumpolar regions and access to the care. So I think that it's going better way forward, and I think that also the indigenous peoples organizations, they have very powerful voice because their position in health and well-being aspects is more poor than those who are living non-indigenous who are living in the same region. And they all are thinking that the mental health and suicide prevention is the thing where it should be focused. Thank you.
Thank you, Arja. Now I have to close this session. A lot of very important issues taken up. I'll thank the speakers and hope that we all have an opportunity to continue discussions privately with different colleagues. But just now only thank you so much for these valuable insights about the mental health in international fora.